Welcome to the Australian Nursing and Midwifery Federation podcast in association with the Australian Digital Health Agency. Today we'll be talking about how digital health is changing the roles of nurses, midwives and care workers. I'd like to respectfully acknowledge the traditional custodians on the lands where each of us are broadcasting and listening from today. Currently, I'm talking to you from the lands of Wurundjeri people of the Kulin Nation and recognise their continuing connection to country on lands and waters that were never ceded. We pay our respects to elders past and present and extend our respect to any Aboriginal and Torres Strait Islander peoples listening today. Welcome to the ANMF Podcast. I'm Julie Reeves, a registered nurse and ANMF's strategic lead. We're continuing our great discussion today about digital health, and we have a collection of nursing and midwifery leaders here to share their insights into digital health and how it impacts the nursing and midwifery workforce and their work. Today we have Commonwealth Chief Nursing and Midwifery Officer, Alison McMillan.
Good morning, Julie.
Senior Midwifery Advisor, Kellie Wilton.
Thank you for having me.
Annie Butler, the ANMF's Federal Secretary.
Hi, Julie.
And Karrie Long, the Chief Nursing and Midwifery Officer for Victoria.
Thanks, Julie.
We also have Alicia Graham, the Digital Health Educator from the Australian Digital Health Agency.
Hi, Julie.
We are so lucky today to be speaking to the leadership of the Australian nursing and midwifery professions. Artificial intelligence, or AI, has been a consistent topic in the media lately. We know that many nurses and midwives see the benefits AI can bring to care outcomes. However, many have concerns about the potential loss of human decision-making and skills that we can lose as nurses and midwives, such as moving from critical thinking to tick boxes, for example, so algorithms can help us with clinical decision-making. Annie, I might go to you first. Can you tell us your thoughts on how we can embrace AI but also protect the roles of nurses and midwives?
Yeah, I think it's interesting. I guess one of the things that we would right now think about it is it's just another tool. And I was thinking about this and thinking, when telemetry first came in, it was just another new tool. At this moment, we know about AI. It's great, but what it does is use knowledge that exists and creates algorithms and does all this work to give us outputs which are extremely helpful. But if something instant, unpredictable happens in that moment, it's not there yet. So a nurse, midwife, or even other healthcare professionals are there to make that instant decision, to react instantly, to read the unexpected. I guess another thing thinking about it is about that thing of AI is a machine and a nurse or a midwife is a human. I can't say that a machine could ever replace a human. I do think we need to be mindful of the risks of where it's being talked about that AI and machines and robots can be used to help deal with shortages. So not replacing, but assisting, so being a tool that assists. So I think there's a whole lot of things to be considering, but any information system you've had in a hospital, if it doesn't make the nurse's job easier, they won't use it. They won't do it. And if it doesn't assist them in that really sort of, it's not core goal, I would say, of nursing and midwifery as like patient advocate, then I think it's going to be more challenging to use.
So following on from that, Annie, because tangible examples are really, I think, quite valuable. I was so privileged last week. I went to the Royal Prince Alfred Virtual Hospital in Sydney. I went to visit them and they were so generous with their time and gave me live examples. So they have a huge range of nurse midwifery-led care. What I was privileged to be a part of was an interaction with a patient as part of their skin integrity work. So nurse-led skin integrity, managing patients across a broad piece of Sydney who need support in maintaining their skin integrity. The interaction was across a computer screen. The AI comes in that it is an adjunct to the nursing-led care because they're using AI to predict likely outcomes of healing. So bringing all of that evidence base, everything that AI can do, using software that interacts with their EMR in RPA, and was just a fabulous example of it was still a human interaction between the patient, who was generous enough to let me witness that care, and then using cameras, handheld cameras from either a carer or a family member, using comparative technology to say, yes, we're on the right path, we might need to look at other things, and what are the variables currently going on with that individual that it can draw from the electronic medical record to really predict likelihood of skin healing. So for me, that was a really great example about it was still nurse-led, it was patient-focused, but AI brought that additional sense to the science that will help make sure that the patient gets the best outcome. I was blown away by this virtual hospital. It's astounding.
That's awesome. And I think that's why we need, as nurses and midwives, we need to be curious. So we can't say that's not going to come into my role or say that's going to be medicine will take care of that. I think we always need to be curious because there's always a different way we can apply things. And I think from my perspective, I often say nurses are the absolute plumbers of the system. They know where there's blockages. They know how to unblock it. They know how to reroute around. They are the absolute stewards of the system. And so then being curious about AI or educated around how you might use telehealth or whatever, they're the greatest problem solvers. And this is the tool that they could really harness to solve problems or find answers to questions that you've always wanted to ask yourself around, could we use X on, one particular wound, or what's the likelihood of X happening to a particular patient? From my perspective, it's that how do we gather the information we have to support us make decisions around perhaps those clinical hunches that we have around, I think most code blues occur on a Thursday, as a really simple example. And then you can aggregate some data and someone can look at that and you go, goodness me, actually, it is on Thursdays because they were admitted on a Sunday, etc. All of these questions that nurses always have, digital health and AI and the adjunct tools are there. I think there's great potential for nurses to really lead some elements of care that we haven't had the chance to have a crack at.
I think that's really interesting and important point. And because we do talk about critical thinking and stuff, but being curious is really important, but we're not always given permission to be curious, even though we are. Whereas COVID, those clinics, those PA clinics came out of COVID when they started that COVID virtual clinic, and then they looked at, oh my God, look at all the things we can do and what can happen, because they were given not just given permission to be curious. Everybody had to suddenly find new ways to do things. And I think if we can continue to hold on to that, about keep all those things you're talking about, Karrie, like what you could really do practically to streamline things and improve things by using these tools in the best way. The disruption from COVID gave us the opportunity to, well, it was a horrific scramble at the time, gave us the opportunity to upend and look at all these things differently instead of just, pursuing the same
linear
paths.
Yeah. Absolutely, and just when you're talking about that, for me, one of the greatest things is around that equity element in our care and our culturally and linguistically diverse people that we serve. There's nothing like an iPhone or any kind of device that can help us communicate more easily and actually, using data to see what are our outcomes of our culturally and linguistically diverse population that we serve as well. I know that, in a lot of research in my previous roles, a lot of studies always exclude culturally and linguistically diverse people. So they're not representative in our research, but digital health gives culturally and linguistically diverse and non-English speaking people a leg up in here that we can communicate really easily with these really great, sophisticated tools, because what's in our hand is often more evolved and developed and more sophisticated than the electronic systems we might have in hospitals. And in my experience in implementing this telehealth is, as clinicians of whatever description, we can come to work with a device, and we might have been translating LinkedIn to see what my colleague in Denmark was talking about. But as soon as we get in the walls, we go, I can't use this way. So there's a mindset element around getting creative, and COVID, you're absolutely right, just said, what tools have you got at your disposal that you can use? And we need to think more liberally about digital health tools in that way.
I totally agree. And I think there's also that thing of how can we use it to be more inclusive? It's a really real potential there, all the things you've just mentioned, Karrie, but I was also thinking about some better interprofessional collaboration and work. And when we can be inclusive, we can look for greater inclusivity in a much broader sense.
Well, absolutely. And something that during my journey in telehealth, my colleagues in psychology coined digital intimacy. That was about in some telehealth consultations with some people that were being treated for mental health, there was a beautiful connection digitally where someone was on their couch at home under a rug. They didn't need to drive 300 kilometres, sit in a waiting room for 2.5 hours in a white lit, scary hospital where there's bing bongs going off all of the time. And it created this digital intimacy. And to some degree there's an equity amongst our peers that occurs, and perhaps this is younger generation as well, are more comfortable, secure messaging within an electronic medical record to say, I'm escalating, Mrs. Blogs because I'm really concerned about this. But had they, and rightly or wrongly, had they had to walk up to that particular registrar to do that, that might have been more challenging. So there are some opportunities around power gradients that might change with digital. And it might go the other way as well, so it could be polarising.
But if we're mindful, if we're alert and alive to some of these things, it can help us build it, design it for the future. Yeah.
Absolutely. Alicia?
Yeah, just with AI, I think that what you've all been saying is absolutely correct in the way that we would possibly use AI as a tool to help the workflow rather than to replace them, of course. I don't think AI possibly could replace because, as you said, there's all those little micro skills that you're not necessarily, it's not visible to your patients or the people in your care, but there's something that's really important. You need to be able to have that knowledge to put input into the AI to get those good responses and the information back. So myself, who is not a nurse, if I was to try and use it in a nursing way, I'm sure I'm not going to get the answers that I want because I'm not using the correct terminologies. I'm not using it in the correct situations and things like that. So I really truly think that having that nursing knowledge is never going to be useless, of course. It's going to be the thing that helps you use these tools effectively. And also on that note, and a little bit off to the side, is when nurses and midwives are using AI, we possibly need to be thinking about when would it be appropriate to be using it and safe to be using this information. Because as we know with any digital tools or cybersecurity and things like that, if you're inputting information into an AI system, what information are you sharing? And coming back to those basics of it is cyber and it is a security issue, that yes, it's going to be a great tool to find information out, but what am I sharing and can that be shared further through this system? And it's probably something we definitely need to be thinking about when we're using these sort of tools.
Absolutely, Alicia. I think that's a really good point. Kellie?
Yeah, I did, just based on what Karrie was saying about our culturally and linguistically diverse population in Australia. I think that from the perspective that, the thousands of the world's languages, we do very well at being able to translate. Where it is still very, very lost are Australia's own Indigenous languages. Many have been lost. There are many First Nations men and women who English is their third language. And I don't think that the digital systems we have in place, while very good for many other culturally and linguistically diverse people, doesn't necessarily capture the unique needs of Australia's First Nations people, and still a lot of work needs to be done in that space to ensure that the digital health that we're delivering also meets the unique needs of Australia's First Nations people.
Very good point, Kellie. Thank you.
Can I just add something, Julie? I think that both those points as well is there's an issue, of course, of trust. There's always an issue of trust in any sort of relationship that's between healthcare provider and care recipient. And I think nurses and midwives are very often that trusted person. And so I guess there's potential as a nurse, as the navigator of these, whatever these systems are, AI or whatever they are, with communities who are more difficult to reach for whatever the reasons are. Kellie's just touched upon, First Nations communities or all different homeless people in all sorts of different areas of disadvantage but difficult to reach. There's going to be an issue of trust of how they get to access these systems or how it's introduced, and they're, I reckon, a key role for nurses and midwives as, like I said, for want of a better word, the navigator or the I'm not exactly sure, but it could be important.
Yeah, I think what you said, Karrie, before about being curious, there is negativity around AI and people do get quite nervous. And nurses and midwives are really frustrated by a tick box because they feel it's taking away their critical thinking skills. But I think that we need to get curious so that we can understand those frustrations and be a part of the decision to change those frustrations. As we were talking about before, AI will assist in evidence-based care and that data and data analytics and using algorithms to help us with those decisions. What we do need to be mindful and curious about is how those biases developed within those systems and how nurses and midwives can use them within their workflow to help them instead of impede or challenge them. So we've come to the end of our discussion today. Thank you to all our nursing and midwifery leaders for sharing their time today. It's been such an amazing, rich discussion. Please see more information from the Australian Digital Health Agency and the links to some of the resources we've talked about today in the show notes. You can find us at the Australian Nursing and Midwifery Federation website, anmf.org.au, and on social media by searching the Australian Nursing and Midwifery Federation. Feel free to share and like the podcast if you can. Thanks for listening.